Hey guys, I know it's not Monday, but special video today on croup. I've had about 3 or 4 patients with this in the last 48 hours, so I need to get some information out to the community on how to manage croup when you're at home when this happens. So first of all, croup is a respiratory virus, okay? So virus is the key, which means there's no antibiotic to get rid of this, okay? It is caused by parainfluenza virus. That is, I'm not going to say it's always caused by that. The most common cause of croup is parainfluenza virus. And that is just a type of virus that can cause the symptoms we see with croup. Now, that is different than the flu. So parainfluenza and the seasonal flu, those are different things, okay? So what happens in croup? Well, croup is when you hear your kid with that really barky cough sound, okay? And what happens is you get swelling right around the voice box in the airway. So you kind of get this hoarse sound. They get what we call stridor, which is most concerning to us as physicians. So the concerning part, though, it's not so much that barky cough. Not all kids need to be managed like in a hospital setting with that barky cough. The concern is when they're just sitting there at rest, say they're just kind of watching TV, and they're doing this, when they're breathing, they're kind of like, like that is concerning when they are just at rest or they're sleeping and you're hearing this struggle to breathe, okay? So that would be a big red flag for us. So what can we do right away when we're at home? If you're in this situation and we're in the middle of winter, it is optimal because you just take your kid outside, wrap up in blankets, put a coat on, and just sit out there. Your kid gets these nice cold breaths that hit that airway because all it is it's swelling right around that voice box in the airway. So it's tight in there. That's why you're hearing this sound. Cold air hits it, and immediately that swelling significantly improves, and you will see them calm down as well. Kids will get very agitated when that's happening, and then they start crying, and then the whole thing can kind of get out of control. Obviously, if you feel like you can't breathe, that's a very scary feeling, and so kids can kind of start to get worked up. So the best thing we can do is try to keep them calm. So yes, if we're in the middle of winter, taking them outside to get that cold air exposure and just breathing that in is super helpful, okay? However, we are in Indiana right now and we are not having these really cold nights. So the other caveat to this is steaming up a shower. So going into the bathroom, turning on that water really hot and getting the steam going. And again, that can help with some of the swelling in the airway as well. I know that's kind of interesting to think about because they're opposite, but they both have a tendency to help, okay? If your kid just has that croupy cough, like a bark cough, but they're not having any breathing issues at all, then, running the humidifier in their room can be helpful as well, okay? Now, if there are times when kids need to go to the emergency room for this and they have to get steroids or they have to get a specific type of breathing treatment when they are really struggling to breathe. If you are concerned at any point in time about your child breathing and you feel like things are getting really out of hand, you go to the emergency room. I tell every parent that if things are escalating and what you are trying is not helping at all, then you just go, and that's okay, and they will take care of you there. I think I hit on all the high points on things you can do at home to manage this. So if you have any questions, you can list them below. Make sure, obviously, call your doctor if you have any questions. This is just trying to give you guys some tips as needed. All right, have a good week.